Okay, can you hear me now, Christian?
Yes.
Okay. I don't know what happened. Hey, Cindy.
Hi.
The
Oh,
internet is sketchy, so it just dropped. Okay, so today your lab assignment was to join me with our Zoom call, and I'm going to do a presentation for you. This is my very good friend. She's going to help us out today. And I just want to give you a little bit of her information. Due to HIPAA, I will not be giving out her name, but she has had a stroke and she is nonverbal. She can communicate, though. I can understand her very well. She is able to communicate with me. Um, there's not very many people that can understand her. I can, but it's taking the time out. So I wanted to um, use her as an example because you may encounter patients like this as you are either finishing your medical assistant program or you are becoming a nurse. I know some of you um, are going to pursue your nursing career, and kudos to that. So, first of all, before I get started, before I go over our topic for the day, she has communication binders. So I kind of wanted to go over them with you that she has had made throughout the years. Some of the hospital staff made and family members have made for her. So this is a way that she communicates other than gestures. She has two different kinds, and I just want to kind of point out some of them. This is the small one that she has, and I'm going to bring it closer to the screen so that you can see they're laminated. That way, they don't get any food or liquids. If something drops on there, it can be easily wiped off instead of destroying the little information on here. So she can point to the square. This says, I want here. And if she's wanting something, she can point to that and then point to the object that she's wanting. Okay. So if we flip it over, then it has the alphabet. If she's wanting to spell something out, if you're not able to understand her, she can spell something. She can point to the letters and you can write it down. Or, if she's wanting that, there's money. If she's wanting money, okay. So then she has a different one. Now, this one, she has had a stroke in her right arm, and she does wear a splint at times. And so she has pictures of her splints. So if she's wanting that done or put on, she can come to this binder and show you what she's wanting. Or she can simply go get the splint and she can tell you that she's wanting it on. If something is not right, once you put it on, she can tell you. She can point to the area that's either too tight or that is too loose, and she will do so, right? Mm-hmm. Okay. So then there is pictures of instructions with words for you as the caregiver of how to properly put on the splint. She has a picture of different stores. If she needs something, she can point to the store for you that she's wanting you to get something for. She has pictures of different items. She is NPO, meaning she is fed by a patient. She can take nothing by mouth. So there are pictures in here of different food items, but it's not relevant to her because she can't consume any of these items. There is different pictures for if she is cold, if she is needing a phone call, she has a little book with her family members' numbers in it, and she is able to point to that family member if she is needing you to make a phone call for her. And the rest are different different pictures, of course, for hair, teeth, clothes, shower, if TV, remote, and trust me, she is able to communicate very well. She has learned how to adapt. She's had a stroke, what, 8 years ago? About 8 years ago, and she has come a long, long way since her stroke. So I have come to love her very much. So today, with her being a nonverbal patient, and she has had a stroke, and it has affected her right side, I want to discuss with you the proper ways of doing a manual blood pressure on her. She has agreed to do this demonstration with me. So first of all, I want to go over the steps of how to take a blood pressure manually. As you see, I have my stethoscope hanging on my neck now. So the equipment that you're going to need, first of all, is your stethoscope and your blood pressure cuff. And I have my blood pressure cuff here. First of all, you're going to palpate your brachial artery. You do need to remember these medical terms because you will be asked those terms. Am I right, Cindy? You're muted, Cindy.
Yes.
Okay. So, and I will put you on the spot when you're in the lab to ask which artery is what. Am I right?
Yes.
Yes. So you're going to palpate the brachial artery. So the brachial artery is going to be where? Is it in the arm or is it in the wrist?
The arm.
In the arm. Okay. So your brachial artery is here. And what I mean by palpating is you're going to use your first 2 fingers, never your thumb because your thumb has a pulse in it. You're going to use your first 2 fingers. You are going to palpate for that artery. And the reason that you are palpating that artery is, 1, to know where you need to put your bell and the diaphragm of your stethoscope. And 2, you need to also line up the lines on your blood pressure cuff. So once you have your artery palpated and you know where you're going to put your stethoscope, you kind of have to keep it in your, you have to draw like an imaginary line, an imaginary circle, imaginary X, to help you remember where that site was that you have palpated. So there's a question that you need to ask your patient before you're taking their blood pressure. Actually, 2. I'm going to take your blood pressure. Is it okay if I take your blood pressure? Then you're going to say, Ms. Jones, do you happen to know what your normal blood pressure is? Why do we ask our patients if they happen to know what their normal blood pressure is? Because we want to inflate our blood pressure cuff only approximately 20 degrees higher than their normal blood pressure. We don't want to automatically assume, and we don't want to inflate our cuff up to 180 to 200. I know that that has been told to a lot of people, but that's not necessarily always the case. Patients with smaller arms may not require you to even pump up to 120. Their normal blood pressure may be 60 over 100, 60 over 110. So you only want to pump up your cuff 20 degrees above their normal, okay? However, if you pump up 20 degrees above their normal blood pressure and you are already hearing their pulse rate when you put your stethoscope on that site, that means their blood pressure is going to be above that number. So you're going to have to deflate your cuff and pump up above that number and then start releasing your valve, okay? So my patient has graciously agreed to let me take her blood pressure for you. So she has had a stroke, like I said, in her right arm. So I'm going to go to her left arm to take her blood pressure. So I do have, first of all, I'm going to clean my hands. I have my hand sanitizer here. For precautionary measures, we both have our mask on. And your blood pressure cuff. Some blood pressure cuffs look the same, some do not. What I wanted to point out to you is this one has an arrow for a right arm or a left arm. So depending on which arm you're using to take their blood pressure in, this is the arrow that you're going to line up once you have palpated that brachial artery, okay? So I'm going to go around her. Again, well, first of all, I wanted to show you your equipment. This, your stethoscope, your blood pressure cuff. This is your gauge, and it has the needle on there. As you are pumping it up, it's going to move. This is your bulb. This is what you're going to pump up, and then you have your valve. Your valve needs to be turned all the way to the right where it is tight, but not too tight where you can manually release your valve with one hand, okay? So you have your cuff, your gauge, your pump, and your valve, all right? And your blood pressure is monitored in milligrams per mercury. So I'm going to go on the other side of our patient because I need to take the blood pressure in her left arm. And a blood pressure is most accurate if you, she has a long sleeve shirt on. So is it okay if I lift your sleeve above your arm? Okay. So I'm going to have my patient relax her arm on a flat surface. And I'm going to palpate for her brachial artery. And I have it here. I'm using her left arm. So I'm going to line up my blood pressure cuff with the left arm arrow aligned with the brachial artery. Once I have the cuff on, I am still going to double check that the arrows are placed correctly. You want to make sure that your cuff is on tight enough, but not too tight. I am able to put my fingers under here comfortably, so it's not going to hurt the patient as I'm taking blood pressure. However, if your blood pressure cuff moves side to side, it's not on tight enough. So you want to make sure it's on snug. So I'm going to verify I have felt her brachial artery once again, and it is in line with the left arm arrow. So now my gauge, this one is does not connect. This is one that sits separate. So I'm just going to set it on a flat surface. I have my stethoscope. And I'm going to line up my stethoscope in the same place that I have felt the brachial artery. Now I know what this patient's normal blood pressure is, so I'm not going to inflate to 180 to 200. Her blood pressure is normally lower than that. 104/60 is your blood pressure. Does that sound right to you? Uh-huh. Okay. So I'm going to explain to you the readings of your blood pressure. I'm going to take all of this off of her. I'm going to fix her sleeve. Is that comfortable? Okay. So your blood pressure gauge has numbers on there, and it has a, this is your gauge. As you're pumping, your gauge moves in a counterclockwise motion. As you are releasing your valve, the gauge should come down steady pace, not too fast, not too slow. The first bump or the bump that you hear, that is going to be the patient's top blood pressure number. There is a name called for the top blood pressure number. I need you to give me the name, not on the call. This is part of your assignment. What is the name called of your top blood pressure number? When you stop hearing the pulse rate, pulse beat, that is your bottom number of your blood pressure. What is that bottom number called? So what is the top number called? What is the bottom number called? How do you know what the blood pressure number is? So this is your lab assignment. Your lab assignment is going to be, what is your top number of blood pressure? What is your bottom number of blood pressure? And you must create a demonstration video of performing a blood pressure on a family member and post it to Edmodo. That is your homework assignment for today, or your lab assignment. So if you have any questions, please reach out to me, and please thank our volunteer today for allowing me to demonstrate a stroke patient that is nonverbal, that cannot communicate, on how to do her blood pressure today. So thank you,
ma'am.
Thank you.
I will talk to you soon, and good luck with your lab assignment, and have fun. Bye.
Bye.
Bye.